I'm Elisa Bass. I'm a registered nurse and I work with Angelina College. What we've prepared for you today is a video that covers our peer assessment. The peer assessment is a well assessment that is performed on a patient that's not hospitalized. Earlier in the semester, you studied about the bedside clinical assessment. That's to be done on a sick patient. It's a more focused and shortened version of the version that you're going to see today. As you know, the peer assessment is a large part of your grade in 1215, your RNSG 1215 course. There are specific criteria that you must meet in order to make the highest grade possible. On page 27 of your RNSG 1215 syllabus, you will find all of the criteria that must be met as an examiner or as a patient on the day of your peer assessment. As you see, the examiner responsibilities: you must wear your scrubs, bring a black pen, a pen light, and a stethoscope. You will perform the physical exam at the time that you signed up for. You'll document your findings without the aides in a room that is separate from where you did your assessment, and then you'll turn in your documentation. If you are being the patient, you must complete all of the identifying information on the Angelina College Nursing form, the assessment form, on page 32 in your RNSG 1215 syllabus. Please go ahead and fill out all of that information that you can to make it easier for your examiner. You must also wear a patient gown, which we will supply. It will be available in the lab. And please fasten your hair back if you have long hair. It will make it a lot easier for the examiner to get to your thorax and the cardiac area. So what you're about to see is just an example of a peer assessment that we performed just to give you an idea about how one goes. My name is Elisa Bass. I'm going to be your nurse today, and I'm going to be assessing you. What is your name?
A.L. Thornton.
Okay. I want to go ahead and talk about some of the confidentiality issues that we face today in healthcare. New legislation has passed, and just to protect your privacy, if that is what you wish, we can use initials and we can cut that out. It's strictly up to you. We wanted to make sure that it's okay that we're videotaping this exam and that we use your name.
Yeah,
is that okay?
That's fine.
All right. Okay then. You've already filled out this history, the Angelina College Nursing Program Assessment Form 1, and I've been reviewing it, and I just had a few questions. I wanted to fill in the blank, okay? I want to talk about your family history. Does anyone in your family have heart disease, hypertension?
Not that I'm aware of.
Okay. What about diabetes?
No.
Okay. Stroke? Anybody ever had a stroke?
I think my grandfather has.
Okay. What about cancer?
No.
All right. That's great. I'm going to go ahead and make those revisions on your health history form. Okay. All right. The first thing that I want to do is I wanted to go ahead and let's test your vision, okay? I'm going to preface this by saying that I've already washed my hands. All of those things that you would normally do prior to interacting with a patient have already been done, okay? Just come with me over here and we're going to go ahead and test your vision. You'll just come right over here and stand. Do you see the tape on the floor? I know it's going to kind of just stand with your feet right there. And I'm going to give you this. And you don't have to put any pressure, but I'll have you cover one eye or the other as I go over here to the eye chart, okay? And we'll just test your vision right now, okay? Okay, you're going to cover your left eye. And if you could, just go ahead and read the one below the red one since you think you can. Why don't you just try the one above it, the one above the red line.
D-E-F-P-O-T-E-C.
Great. Now then, cover the other eye. Now I want you to read that same line backwards, okay?
C-E-T-O-P-F-E-D.
Okay. Now then, you can just look through both of your eyes. What's the lowest one you can read now?
F-D-P-L-T-C-E-O.
Great. All right. All right. We're done with that. I'm going to go ahead and get your height and weight. Okay. So have you had any weight loss or gain here lately?
I think I gained a couple pounds.
Really? You were trying?
Trying to.
Okie dokie. I think these scales really are kind to women. Okay. And if you would, just turn around. And I'm going to get a quick measurement on you too. Just stand up as straight as you can. And I'm putting this down because I'm going to need both hands. Okay, you can just step out from under it now and go get on the bed. You can just take a seat back on the bed. I'm going to go ahead and get your vital signs. I also wanted to add, for those of you who haven't been through this whole process, if you're in the hospital, during your peer assessments, of course, if it is applicable, you would want to wear gloves, which I've got my gloves over. You can't see them, but I will use them when they're appropriate. If in the hospital you are dealing with anything that has the potential to contaminate you or your clothing, if you're irrigating wounds, if your patient is particularly sick and is vomiting, you would want to wear eye protection as well. So I just had these here. He's fine. I'm going to put them to the side, but had I needed them, they were here for my use. There you go. Okay. So when was the last time that you actually went to the doctor?
It's been a while because I haven't had.
You've just not been sick at all?
At all.
So do you recall what your last blood pressure was?
It was normal.
Okay.
I called it exactly.
Okay. Never had a problem with hypertension?
No.
And I noticed from your history that there's nobody in your family, so that is great.
So I need to relax my arm or just.
Yeah, I just want you to kind of lay it right there. That'll be just fine. Okay. And your blood pressure is just fine. I'm going to go ahead and take your temperature too. Just under your tongue. You can close your mouth. That'd be great. You're perfect. That's a rare instance. Alrighty then. And go ahead and record that. Okay. All right. What I'm planning on doing today is just a head-to-toe assessment. Okay, I'm going to start right at the top of your head and we're going to work our way down. I'm going to do a lot of touching and feeling, and I'll try to explain to you as I'm going along kind of what I'm doing and feeling for. Sometimes I may double back and cover an area again. Don't be alarmed that there's something wrong. Usually it just means that I forgot something and I want to swing back over there and pick it up, okay? So just to make it a little bit more comfortable for me, I'm going to raise your bed just a little bit, okay? So tell me if you have to jump and run because we don't want you to hurt yourself. Okay, all right. Now then, this is a little bit more appropriate height for me. Again, I'm going to start at the top of your head and we're just going to work our way down, okay? Right now, I'm just kind of feeling for any abnormalities in your head, okay? Now you had told me prior to starting the interview process that you had had an old head injury, and I feel that scar right there, okay? There are lymph nodes that occur and they will swell as part of your body's immune system, and that's kind of what I'm feeling for right now. They happen all along there. Okay. This is an important area too. I'm going to go ahead and touch right over your clavicle area. Okay. Okay. That's fine. I need for you to make some funny faces. We can test some cranial nerves. Well, that one was good, okay. The big smile was really good. I need you to broad smile, okay. Now crinkle up your forehead. That's good. Okay, you can open your eyes. Tell you what, I'm going to go ahead and just test your ability to perceive light touch. I want you to close your eyes, and I'm going to touch you in some different areas of your face, and I want you to tell me where you're feeling them, okay?
Left side.
Okay.
On the right side. On my cheek.
Okay, which one?
Left cheek.
Okay.
Right cheek. Chin.
So you've got kind of a half beard there, and so we'll leave a trail. Did you feel
On
that?
the right side.
Okay. I'm going to go ahead and put on my gloves. Now you can open your eyes. I'm sorry. Just left you sitting there with your eyes closed. I just kind of want to take a look inside your eyes. I'm not going to do an ophthalmic exam. I'm not going all the way into your eyes yet, but I do need to kind of touch your eyelids and look inside, okay? Alrighty, can you look down? Okay, is there any pain at all?
No.
Right through here? What about through here?
No.
Okay, what about here?
No.
None? Even when I press? No? How about here?
No.
Okay, great. You notice any tearing, anything like that throughout the day? I know you study and you play basketball, so you don't have any visual problems at all?
No.
Great. Okay, we're done with that part. Now then, I just kind of want to test to make sure that your eyes are seeing normally and are parallel and everything, okay? Just try to keep your eyes open. I'm going to shine a light into them. What I'm looking for is your pupillary response, okay? Very good, okay. Just look straight ahead, look straight at me, and I'm just going to shine a light right at your nose, and looks good. What I was looking for is that the light was hitting your eyes in about the same spot. Sometimes, especially younger children, there's an imbalance there, and what can happen is one of the eyes will be turned in, okay? Just to double make sure that everything is fine there. I'm going to have you look at a spot on the wall back here, and what I'm going to do is cover one of your eyes, and I want you to keep looking at the spot, okay?
All right.
Same spot, all right? That's great. Keep looking. Okay, and your eyes didn't even move, so that's great. Right now what I'm doing is I'm testing to make sure that this pupil over here reacts when this one is stimulated. And yours does. Let me get the opposite direction there. Okay, looks great. All right, well that was really good. Right now I just want to test and make sure that the muscles around your eye are working appropriately. What I'm going to have you do, I'm not going to turn this on, I just want you to look at the tip of it and then follow it with both of your eyes. Keep your head really still, try not to move your head at all, just follow it with your eyes, okay? So far, so good. We're halfway done. And this is my favorite part coming up. That's where I want you to follow it in, okay? I just do that to make you cross your eyes, that's all. So, okay, enough about that. Your eyes look really good. What I'm going to do now is I'm going to move on to your nose. I just want to kind of look inside and see if anything's going on there. You've never had nosebleeds or anything like that. What about seasonal allergies? Do you have a problem with that?
Not a serious problem.
No? Do you have to take meds sometimes during pollen season?
Yeah.
Okay. I'm just going to look up and just see if there's anything really visible. Looks great. Okay, nice and clear. I'm going to occlude one side, and I just want you to kind of breathe in and out through the side that's free. Okay, other side. Okay. Have you noticed any changes in your sense of smell?
No.
You can smell odors? Okay.
Fine.
All right, then that's great. When was your last dental visit?
Probably a year ago.
Okay, any problems with your teeth?
No.
No missing ones, everything's fine.
Everything's fine.
How often do you brush and floss?
Brush once, maybe twice a day.
Let's see, twice is good. What about flossing? You do that?
Not really.
Okay, well, you know, we want to go ahead and recommend that you get in the habit of doing that. Okay? All right, I'm going to look in your mouth. And I promise I won't gag you, okay? Just need for you to open up real wide so that I can see. Oh, that's great. I don't even need really the tongue presser, okay? Can you say, ah? I'm going to do it one more time. Stick your tongue as far out as you can. Very good. Okay. Lift your tongue way up. Great. Okay. I'm counting your teeth. All righty, 28. So when did you have your wisdom teeth removed?
Haven't.
Oh, they haven't grown in yet.
No,
Okay, well that will happen sooner or later. I'm going to move on to your ears now, okay? Earlier I had kind of swapped across here just to make sure that everything was even, and I see that it is. There's no tenderness there. Let me know if I'm causing you any pain. Sometimes I, get into what I'm doing, and if I'm hurting you, just let me know.
Everything's fine.
Okay, great. Have you noticed any changes in your hearing?
No.
None? You're able to hear everything in the classroom that
Just
you
fine.
need? Okay. What I want you to do, I'm just going to do just a brief assessment on your hearing. It's called the whisper test. If you could just take one of your fingers and cover up this ear, and I'm going to whisper something over here, and you tell me what I whisper.
Cover it up totally or just?
Yeah, just stick a finger in the canal there. That'll be fine. Okay? 99.
99.
Okay. Let's do the opposite ear. 42.
42.
Okay, that's great. Problems there. This is an otoscope. I need to look inside your ears to see if your tympanic membrane is fine. You're kind of in an awkward spot for me.
You like me to scoot up?
Yes, do you mind terribly? Just scoot up, not to the point where you might fall off the bed. That would be bad, okay? Because, as I said before, you're really, really high. Tell me if I'm causing you any pain. A lot of times this just feels like it's going to cause some pain. Kind of freaks people out a little bit. Okay, how do you normally clean your ears?
Q-tips.
Okay. You don't go all the way inside, right? Okay. Because, if you jab those Q-tips down too terribly far, you can actually end up injuring your tympanic membrane. It's a lot closer than what you think. Your tympanic membranes look great. They look great. Okay? I palpated your lymph nodes a while ago. Right now, I just want to make sure that your trachea, that's right here, is midline. Okay, and it is. And right now I'm just feeling for your thyroid gland, okay? Normally it's not palpable. Okay. Just want you to swallow, okay? I know that's hard when somebody's got a big grip on your neck there. So, all right, that felt just fine. Right now I'm feeling of your carotid pulse, okay? Nice and strong. Okay. I just want to see how mobile your neck is. Do you ever have any problems with your neck at all? Okay. Just kind of lay it over like this and over the other side. No pain?
No pain.
Okay. See how far up you can look and down. And now twist it from side to side like that. No pain at all? Okay. I'd like for you to just kind of push against my hand. I'm going to see how, turn your head like that against it. Okay, good. Other side. Good. Okay, now then I want you to clench your jaw, and I'm going to try to open your mouth. Good. Now then shrug your shoulders up against my hands, okay? Great. Nice equal strength there, okay? I'm going to go around to the back now, and I'm going to start feeling of your vocal sounds through your chest, and I'm going to listen, okay? Okay, Mr. T, if you could just lean your head forward. I'm going to be kind of pressing on your spinal cord or column here to identify some landmarks, okay? All right, that is C7. There you go. And you tell me if you feel any tenderness, I'm causing you any discomfort, okay? No pain?
No pain.
Okay. Now then, what I'm going to have you do is just take a really deep breath and let it out.